Hello, my name is Caitlin Palachek, and I am with Cook County Health and Hospital Systems. Thanks for joining us. Do you have questions about healthcare? Call our patient support center at 312-864-0200. My guest tonight is Dr. Rami Doukky, who is the Chief of Cardiology at Cook County Health and Hospital Systems. Welcome to the show, Dr. Doukky.
Thank you very much. Thank you for having me.
You're welcome. So Stroger Hospital was recognized by U.S. News & World Report for its highest ratings for heart health failure care in their annual Best Hospital rankings. Can you tell us a little bit about how this was earned?
Indeed. Many of our viewers recognize U.S. News & World Report as a magazine that produces ranking for a variety of things, including colleges, graduate colleges, law schools, medical schools. U.S. News & World Report also produces annual rating of U.S. hospitals. They obtain data from over 5,000 medical centers in the United States. They look at a variety of data, such as access to certain medical treatments and outcomes, such as mortality, and they produce a ranking for these hospitals. The ranking that Stroger achieved in the care of heart failure as high-performing center is really granted only 18% of medical centers in the United States. This is achieved really through a team effort, which basically ensured that delivering appropriate state-of-the-art medical treatment to our patients, also access to important diagnostic and treatment procedures such as bypass surgery, valve surgeries, and certain device therapies that can improve the outcome of heart failure, as well as implantable defibrillators that can occasionally be life-saving for patients with congestive heart failure. So it was really a team effort from a variety of services, specialty and general medical services, clinics, diagnostic laboratories, surgical services, obviously the intensive care unit and the division of cardiology. It was truly a team effort.
Great. And can you tell us about some of the most common diseases of the heart?
Sure. Probably the most common disease, most commonly encountered disease is occlusion of the heart arteries, which is called coronary artery disease. It is very common. It is the #1 killer in Western society. And in addition to coronary artery disease is congestive heart failure, which is a condition in which the heart fails to deliver appropriate blood flow to the rest of the body. Other common conditions include valve disease, such as stenosis or tightening of the heart valve, or leakage, or so-called regurgitation of the heart valves. Also, irregular heart rhythm, or what called cardiac arrhythmias. Most common one of them actually is atrial fibrillation, which some of the viewers are familiar with, which is a condition that predisposes patients to having a stroke.
Okay, and how long do you live with heart disease?
It's obviously highly variable. Some life-threatening conditions might be life-threatening within seconds or minutes, where there are other conditions that people can live with for decades. Really, it's really a spectrum depending on the kind of heart disease you have and the severity of heart disease you have. Now, the good news I have for our viewers tonight is that in the 70s and 80s, congestive heart failure, for instance, was considered a death sentence. Mm-hmm. Over 50% of patients would die within a couple of years. Now, with modern treatment and interventions we provide our patients, I have patients have been seeing me in my clinic for more than a decade, or sometimes two, with congestive heart failure and good medical treatment and good device therapy. Patients can live for a long period of time. In addition to medications, obviously, leading a healthy lifestyle is key for living a long, relatively healthy life with congestive heart failure, for instance.
And what are the known risk factors for heart disease?
Well, it's a spectrum of risk factors. What I tell people, heart disease is like the things that clog up your kitchen sink. It's not one thing. It's a variety of things that lead to heart disease. To make them simple, there are things that are what we call non-modifiable risk factors, things that we're born with or we're destined to have, such as aging, Male gender is a risk factor, and also our genetics, our family history. For example, having first-degree relative with premature onset of heart disease. And there are modifiable risk factors, which our viewers should be most attentive to, such as smoking is extremely important, and hypertension, diabetes, high cholesterol, all these, obesity, all these are modifiable risk factors patients can do a lot about to prevent from having in the first place, or modify them with appropriate lifestyle changes or medications.
Great. And what should a person's ideal blood pressure be?
I wish it's a very simple answer, but I would say less than 130 for systolic or the high number, or less than 80 for the diastolic or the lower number. We diagnose high blood pressure when the blood pressure exceeds 140 for the systolic or the high reading, and more than 90 for the lower reading. However, generally within the normal range, lower is better. Less than 130, less than 80 for the lower number would be preferred.
Okay. And what are some warning signs of someone that's having a heart attack?
Most common is chest pain. Usually crushing pressure chest pain, but sometimes could be burning sensation. But also it could be some a little bit less common symptoms would be having shortness of breath, feeling fatigued, sweating, nausea. It could be non-specific. I would say chest pain and shortness of breath. I want to mention here that women tend to have atypical presentation, more with trouble breathing and fatigue rather than chest pain. So I would say particularly for our women listeners or viewers this evening is don't be dismissive of these symptoms even if you do not have chest pain. Shortness of breath could be a warning sign of a heart attack. I want to mention actually women presenting with the first heart attack, actually they're more likely to die with a heart attack than men presenting with the same kind of heart attack.
And what should you do if you observe someone experiencing these symptoms?
First of all, I would say either go to the emergency room or call 911. If you have aspirin at hand, aspirin could help actually save lives of patients with having a heart attack. So if you have an aspirin, go ahead and take it, call 911. Diagnosing heart attack cannot be diagnosed by the layperson. It requires specific and specialized testing such as EKG and specific blood tests. This is something you do not want to guess whether you have or not. Always go to the emergency room where you can get the proper diagnostic testing and the proper treatment.
What treatments are currently available for heart disease?
Well, it's a spectrum of things. Start with fantastic medications that have evolved over the past 3 or 4 decades that really changed the trajectory of heart disease and the natural history of heart disease, but also other things such as a variety of procedures that do not require open heart surgery, which is such as opening the blocked artery with balloon and stents, but also surgical treatments such as bypass operation or valve surgeries, implantable devices such as pacemakers or defibrillators, the combination of all these developments over the past 3 or 4 decades really changed the trajectory and the natural history of heart disease. I want to stress, however, the primary game in when it comes to heart disease is really prevention. Prevention is key. All these nice, advanced procedures we have are only to treat disease when it evolves. But the key is prevention.
And what can folks at home do to prevent heart disease?
I would say first and foremost, if you smoke, stop smoking. This is a certainly modifiable risk factors that's particularly linked to early onset or young onset of heart disease. But in addition to that, living a healthy lifestyle, exercise regularly, eat healthy diet, fruits, vegetables, less red meat, and again, regular exercise, stay away from obesity. All these kind of lifestyle interventions can minimize the risk of developing high blood pressure, diabetes, high cholesterol, and the eventual development of heart disease.
You mentioned regular exercise. What defines regular exercise?
I would say 30 to 40 minutes most days of the week. So if you exercise 4 to 5 days a week for 30 or 40 minutes, If intense enough just to have hard time carrying a conversation. If you are a trained athlete, good for you. But any brisk walking would be better than nothing. Even walking is better than sitting on a couch. Anything you can do is better than nothing. But certainly, having a regular exercise for 30 to 40 minutes most days of the week is advisable.
Thanks. Let's talk about who is most prone to heart disease. Does gender play into it? Family history?
Definitely. Gender is an important risk factor in young adults and middle-aged individuals. Men tend to have earlier onset of heart disease in their young adulthood and middle age. However, as we grow older, women actually surpass men in heart disease in their, let's say, after age 80. So women catch up after menopause with men, and if anything, they surpass them. As far as family history, it's certainly one of many risk factors that contribute to heart disease. Again, if you have a first-degree relative who developed heart disease in young age, this is certainly a risk factor. However, I would say family history play in combination with other risk factors, high blood pressure, diabetes. So even if you have family history of heart disease, by no means you're destined to have it. Avoiding diseases such as high blood pressure, diabetes, and high cholesterol by regularly exercising, observing healthy diet, not smoking. These are all important interventions that you could do to mitigate the risk of family history.
Thanks. Can you talk about the reality of this? Is there any truth behind a broken heart?
Well, certainly stress and mental stress, whether it's chronic or acute stress, contribute to cardiometabolic derangements such as high blood pressure, perhaps diabetes, that can contribute to development of heart disease and perhaps even a heart attack. Now, there is a specific term called broken heart syndrome, which is not common. It happens more often in women than men, and it usually observed after severe, intense stress or devastating news, like somebody's loved one dying, or some really devastating news where the heart becomes dysfunctional. Usually it lasts weeks, and it tends to recover. And it's called broken heart syndrome or stress cardiomyopathy. But probably that's not what you're mentioning. This is a specific syndrome called broken heart syndrome, or the slang for it. But certainly stress is a contributor, perhaps is a contributor to heart disease. Things like yoga, meditation, but more importantly, actually regular exercise. Regular exercise is not only good for your physical health, but also your mental health. It reduces anxiety, stress, and it can help you actually cope with your life much better.
Thanks. Well, summer is evidently around the corner, and we all know that heat is very hard on the heart. What are some general precautions that people can take?
I would say first and foremost, stay hydrated. Always have a bottle of water with you. Drink ample amount of fluids, and avoid dehydration. Also, during heat advisory days, stay at home. The most elderly and the most young are most vulnerable to heat stroke. So if during extremely hot days, stay home. Avoid going out unless you really have to.
What about those who have to do their work at home or outside of the home? So they're exposed to the heat every day.
Again, ample hydration. It's stay in air-conditioned, sheltered place, and stay hydrated.
Are there any specific foods that people should be eating at that time?
Nothing in particular. Aside, again, always healthy diet is a good thing. Avoiding dehydration by drinking ample amount of fluid is simple. Precaution to avoid heat stroke. Apply sunscreen. Obviously, this is not heart related, but skin health related. But obviously, with the summer days coming up on us, apply sunscreen and stay hydrated.
How much is an ample amount of fluid?
I would say 2 to 3 liters, which is throughout the day, especially if you're exposed to the elements. You're outside. Always keep a bottle of water with you, and do not be outside unless you really need to.
Mm-hmm. Does Gatorade count as an ample fluid or just water?
Actually, Gatorade would be considered fluid, and it has also electrolytes, which is lacking in water, but also it has sugar. So you got to be careful about that.
Cool. And what advice would you give for the young people out there that are studying to be cardiologists or in the medical field?
Well, I would say cardiology is a very exciting field. It continues to evolve and amaze us with the progress we make over the years. Cardiology today is unrecognizable, I would say, if you look back 30, 40 years ago, and it will continue to progress. I also tell them that we will need cardiologists for as far as the eye can see. With aging baby boomers, heart disease is going to be abundant, unfortunately. We need a lot of cardiologists to take care of these patients. Also, heart disease, or cardiology is becoming more complex, more procedures coming up, and that will require more and more specialized cardiologists coming down the pipeline. So I would say be ready for an exciting, fulfilling career in cardiology.
And where do you see the future of cardiology being headed?
I would say going to be more and more, we're going to be staying away from open heart surgeries. We're going to be doing more and more technology allows us to do more procedures by catheters rather than open heart surgery. There are going to be more devices implanted, more procedures to treat heart conditions. However, I would say the game to win heart disease is not going to be by treatment intervention. Is going to be mostly through prevention measures. Again, maintaining healthy lifestyle is key.
And you said that you guys are staying away from open heart surgery. Does the type of treatment predict on the recovery time?
Yes. Well, again, this is complex. There are cases where open heart surgery is the only or the better choice. But I can see going in the next 5 to 10 years, more and more procedures are going to be done percutaneously or through the skin with catheters rather than open heart. And generally, these type of procedures are associated with shorter recovery, getting out of bed sooner, getting home sooner. And we're going to continue to see more and more of these procedures coming in the next decade or so.
And what are some of the other procedures?
There are procedures, for example, now of treating the valve conditions with catheters rather than open heart surgery. 20 years ago, it would not have been comprehensible that to treat valve condition with anything but surgery. Now, procedures have been developed over the past 10 to 15 years, where we now can treat certain valve conditions with catheters rather than open heart surgery. More of these will be coming up in the next 5 to 10 years.
Cool. And then is there anything else you think that we need to know?
I would stress to our viewers that heart disease is the number one killer in Western society. We strive to make it number 2. Probably in our lifetime it will become number 2. And that will be not only by modern technology, although it's very important, but it's going to be by prevention. 80% of heart disease is preventable. Again, lifestyle, exercise, diet, avoiding obesity, and staying away from smoking are the key for a long and healthy life.
And what kind of advice would you give people from staying away from smoking? Since that is a contribution.
First of all, never smoke. That is the first one. No one starts smoking a pack a day. Everybody starts with 1 or 2 cigarettes a day, and it will creep up on you. It's highly addictive. So first of all, don't pick up your first cigarette. So that is advice number 1. And advice number 2, if you fall for smoking, seek advice from your physician. There are plenty of interventions that can help you quit smoking, whether it is medications or other type of interventions that can help you cope with the nicotine addiction and get you rid of the habit. It is a very difficult habit to quit, but it is very important.
Thanks. Not to interrupt, but we do have a caller.
Cool.
Hello and welcome to the show.
Hi. Doctor, I was just diagnosed with congestive heart failure, and I'm just freaking out about it because I'm just concerned that I might end up in the ER again and might have another heart failure. Are there things that I can do?
I would say first and foremost, stay under the regular supervision of a qualified physician. Whether that's a cardiologist or a general medicine doctor, depending on how complex your condition is. First of all, stay under the supervision of a qualified physician. Secondly, medications, taking your medications regularly is the key to avoiding ER admissions and hospital admission. So take your medications religiously. These medications not only will make you feel better, but also live longer. Now, once you do that, there are other things that you can do to improve your heart failure condition. Certain patients might benefit from exercise program or cardiac rehabilitation program. Avoiding excess salt consumption. Salt can promote fluid retention in the body, and that can make your heart failure worse. Regular exercise, as I said, whether under the supervision of cardiac rehabilitation or just engage in a regular low to moderate intensity exercise, can also help improve the way you feel and perhaps also make you live longer. In addition to all that, being under the general supervision of a cardiologist, there are other things that could be done for heart failure in addition to medication and lifestyle. There are certain devices that can help improve symptoms and also improve survival with heart failure. Now, again, as I mentioned earlier, heart failure back in the days in the 70s and 80s used to be a life sentence, basically, a death sentence. Now, with the modern treatment we have, patients live for decades. So, my message to everyone out there, it is heart failure is a condition that is highly treatable, and there's a lot of effective interventions for it. And if you do all of the above, there are a lot of options that make people feel better and live longer. Patients who are really doing poorly with heart failure, what we call end-stage heart failure, and I hope our viewer is not one of those. There are other kind of potential interventions that can be beneficial. One is what's called a ventricular assist device, which is in a way sort of an artificial heart or a device that can help your heart pump more efficiently, and also heart transplantation. I hope that. With good medical treatment, many patients would avoid being at these type of interventions.
Thank you so much.
Of course.
Thank you.
Thank you for your call.
Well, Dr. Doukky, it's been an absolute pleasure having you on the show. You have provided such a wealth of knowledge, and I hope that we can have you back again soon.
Thank you very much. That will be my pleasure. Thank you for having me.
Thanks.